I realized that there are enough dentists saving teeth. Someone has to focus on saving colleagues, so I did step out of clinical dentistry to do this. Move your stool into a different o'clock position. Move your patient. Ask your patient to turn left, right, chin up, chin down. Do anything but twist your spine.
I'm right-handed, but I'm holding the mirror in my left hand, so I'm moving around my right hand, I'm picking things up, I'm returning to neutral, whereas my left is my mirror, and therefore it's staying in that position, and that is part of the root cause of why we have a lot of issues.
Very much so. If you are in the habit of taking your head down to the mobile phone, you're damaging your spine. We need to keep reminding ourselves that we are important. My motto is, take care of yourself. You are your most precious instrument. You only have one precious spine.
Imagine being at the peak of your career, done all your courses, education. Now it's really time to practice dentistry, enjoy your dentistry, and make a difference to people's lives. But then out of nowhere, you start getting this horrible backache, which means that you need to start canceling your days. You are in severe agony. You can't even look left and right, and you're barely able to dress yourself. Protrusive, I'm Jazz Galanti, and I've just described a harsh reality for so many clinicians around the world. And it's not a surprise. We know that back problems are a health hazard, an expected health outcome of being in dentistry. But my friends, this episode will tell you that there is a way out and that it doesn't have to be this way. Our guest today, Dr. Aniko Ball, is the expert on optimum ergonomics for dentistry. Let me tell you how I learned about her. It was on the community. We were talking about back issues, and Dr. Lane Ochi, who else but the legend of Ochi, he said something so profound. He said, Jazz, look into the Alexander technique. And I'm all about prevention. So I looked into it and I found Dr. Aniko Ball. The problem is she's all the way in Australia and I'm all the way here in the UK. But as I started to delve deeper into this, it was very interesting. There are optimum ergonomic techniques that we should be doing day in, day out that no one has taught us. And what Dr. Lane Ochi had to say was that he thought he was done in his early 40s, right? He had a chiropractor come in every day at noon to adjust him. Now, bear in mind, Lane Ochi, at his prime, Beverly Hills dentist and a phenomenal dentist. Like, he is the best dentist in the world. Lane, I know you don't, you're too humble to admit it, but he is, right? Let's just be honest. So Lane had a chiropractor come every day at noon to adjust him. How mad is that? Then he learned about the Alexander technique. It's not treatment, it's learning how to use your body correctly and not hurt yourself. It took a while to make postural changes, but once I did, no more pain. I cannot stress how important proper ergonomics are to your health and happiness. Amen to that, Dr. Lane Ochi. The mission I gave to Dr. Aniko Ball for today's episode was to give us just five damn good tips, and I mean like life-changing stuff to save your neck and back. And boy, were they epic, because each one of them are pretty much implementable straight away. One of them requires a purchase, but it's a great recommendation because you all asked about Loupes. So this is a must-listen episode. We love the episodes about onlays and composites, and some of you like the occlusion ones. But in terms of health and well-being, without which we cannot perform our dentistry, this is probably up there with the most important episode of all time. Now, the Protrusive Dental Pearl, at the time of recording, we're in January, and on the community, we have a theme of perspective and gratitude. And tying in the theme of health from this podcast, let's get this health perspective. What are you doing in your life to look after your health? It's the usual cliches. It's things we already know we should be doing. Are you eating well enough? Are you sleeping well enough? Are you making time for exercise? Or do you feel like you're trapped in this treadmill? Many of you, like me, are parents, and so like you go to work and you give everything to work, and you come home and you give everything to your kids, and you don't have any time left for yourself. I'm telling you, if you're living life this way, you need to change. And you already know that. We all already know that. You need to make time for your health. This could be little things like the occasional blood test now and again, which I am a fan of. Getting off of social media. Obviously, protrusive guidance doesn't count. That's like a community, that's help. But getting off of toxic social media, and the time you'll probably save from that will allow you to just go for a run for half an hour. It doesn't have to be like a gym membership. And another cool thing about just what we eat is really, if you count how many meals, how many variants of meals that you have, we all probably only eat about 10 to 13 things. That's it, on repeat, and we just cycle through those. How can you optimize each meal? If you just start there, that's gonna make such a big difference to your year. And it's stuff that you already know, but sometimes it's nice to hear those things again. Anyway, do join us on the Protrusive Guidance app for our community monthly themes, which I'm really excited about. And now, of course, let's look after your back. And at the end, I will reveal that Dr. Aniko Ball will be coming to the UK. I'm flying flying her over because I want to learn from her. I want the team to learn from her. I want you all to have access to her. She hardly ever, I don't think she's ever come to the UK actually to do a full course. And we are in such dire need of the Alexander technique applied to dentistry. And she's going to do a full day lecture. And I want you to come along and bring your nurse or dental assistant. And we're also going to have a live stream, because what she does is she does a lecture and then she demos it, because we'll have a mobile dental chair. She'll demo it and everyone will get to see, and we're going to have a cameraman there projecting it. And so nothing is hidden. Every little nuance on how to use your hips for an extraction and not your shoulders for an extraction, or how to even hold your mirror with the correct finger rest, everything will be shown in crisp detail, whether you're live in person, which I recommend. There's a magic of live. Or if you're not able to come and join us in London, then there'll be a live stream pass, because you're going to gain so much in that day. And the best bit of all, you know what we're calling this event? Going with the theme of Unshippable, one of our occlusion and composite courses, we're going to call this Unbreakable. How to make your body and your back unbreakable with Dr. Aniko Ball, brought to you by Protrusive, Saturday 13th of June. Do save the date in your diary. I'll remind you at the end, but the URL for the event will be protrusive.dental/unbreakable. That's protrusive.dental/unbreakable. Let's now join the main episode, where she's going to give you so much to take away to already improve your posture and ergonomics. And I'll catch you in the outro. Dr. Aniko Ball, welcome to the Protrusive Dental Podcast. Long awaited. I had a Zoom with you a year ago because I was just so excited to bring you on the show and actually bring you to the UK, because a mutual friend of ours, Dr. Lane Ochi, we were discussing on our community app on Protrusive Guidance about back pain and how miserable it can be for dentists and how prone we are to back problems, and of course the wider dental team. And then Lane said something that it was because of the Alexander technique that saved his career in his 40s. He would not be practicing beyond his 40s if it wasn't for the Alexander technique. And then I was then researching about it because I had no idea what this was. And then you came up as number one. So then I started to sort of stalk you online and see all your good stuff. And I was like, this is amazing. You're talking so much sense. And I'm so excited to bring you on today. So tell us about yourself, your journey, dentistry, and pivoting into ergonomics.
Well, it's quite a story. Like every other dentist I know was in pain already as a dental student, and it just got worse. And I had my own practice. I went into periodontic, dental sleep medicine, and I was frequently having to cancel patients because I just couldn't move. I went everywhere for help. I went to every doctor, specialist, physical therapist I could think of, and they were all very helpful. However, what I got was symptom relief. No one actually looked at the cause. No one asked me, well, Aniko, show me what you do with your body when you do dentistry. And I didn't know that there are certain rules, road rules and guidelines when you are holding postures as we do in dentistry. And it wasn't until I came across the Alexander technique and I was desperate. I was declared a hopeless case by my doctors and I prayed for help. And then I came across the Alexander technique, picking up a book, and that led me to explore it more. And then I decided that I need to train. I did 4 years, 1,600-hour part-time training in person, and then spent over 1,000 hours, if not 2,000, to translate the inner ergonomic principles of the Alexander technique to dental industry-specific application. And that's what I did. And that hasn't been done anywhere before, but I was passion-driven because I didn't want my colleagues to suffer the way I did. And I realized that now I was dealing with the cause. I was, unbeknown to me, I was doing everything that the body is not designed to do when holding postures. And once I knew that, I began to apply that to myself and change my work postures, and I wanted to share it with my colleagues. I wanted to save my colleagues from suffering. And that's how come I set up Optimum Dental Posture, and I run workshops, and it's my great pleasure to connect with you and your community of dentists so that they will learn.
Honor to have you, and we're going to give them some really tangible, because there's only so much you can cover in a 45 minutes or 1 hour episode. But if I can make a difference to anyone who listens or watches this today, and if we can together distill 4 or 5 really good tiny things that make a big difference, right? These leverage points, right? These small details which have a big impact on their back health, that will maybe inspire them, say, okay, wow, this has actually helped me a lot, but there's more to it. You know, you've done thousands of hours into it. I didn't actually know that the Alexander technique wasn't for dentistry. So when me reading it, I read Alexander technique that Lane wrote, and I thought, oh, okay, this must be some sort of dental ergonomic technique. But Okay, obviously it's not. It's a wider thing that you've applied to dentistry. Is that right?
Yes, this has been well known for over 100 years in the performing arts field. Musicians, dancers, actors, singers, and it had been taught according to their learning style, but not the way we learn, and it didn't speak to the dental learning style. And I realized that very early on, and I knew I had a lot of work to do to make it specifically for us.
Let's get a little bit philosophical before we go into those 5 points, right? And this is a little bit controversial as well, okay? So there is, I liken things to occlusion, like always, right? And so when you teach the techniques to a dentist that you think are so foundational that to you almost seem common sense, but the dentists are like probably mind blown, like, oh my goodness. And probably 99.99% of the room that you teach are like, how did I not know this? Why didn't they teach me at dental school? And when we're teaching occlusion, it's exactly that. What me and Mahmood think, we're thinking, okay, this is very, very foundational basic. And that's like the biggest takeaway of that dentist when they leave and they start practicing. It's like, wow, occlusion is actually practical. It's actually making sense and I can do this. And so I'm sure you experience that all the time as an educator, because the baseline knowledge that's given at dental school for various reasons is just not good enough. And I think one of your missions from speaking to you, one of your missions in life is how can we get what you're about to teach us today and much more into the dental curriculum? Because when we think about it, if you go into maybe acting school or if you learn to play the violin, I'm sure there's a chapter about, hey, how to play it in a way that's not going to mess up your neck and how to act in a way that your back's not going to get messed up. Even wrestling, right? When people are wrestling, they're like, okay, when you fall in this way, not to mess up your back. Isn't it funny how in dental school, a profession that is so prone, and it's well known, it's well documented that we are prone to back problems, that something like the Alexander technique or just general ergonomics is not that well taught.
Exactly. I thought, and every dentist seems to think, that you can twist and bend and do whatever with your body in order to get the work done. The problem is that there are joints that are not designed for prolonged bending, like all of the back, for example. And there are muscles that are not designed for prolonged contraction, like the muscles of the shoulder and arm and hand. So immediately you can start thinking, and dentists are surprised when I tell them this.
It's something that's ingrained into us. We pick up these, what we don't know are bad habits, and then we suffer. And it's like, you might not suffer on day one, but aggregated, and how much time we spend that posture. And then suddenly there's more to it than just posture. There's other factors as well. And suddenly that's a tipping point. And then that's when we suffer and we have to cancel our list. My principal won't mind me saying this, but I was telling you not in a meeting that he's been suffering a lot recently. I actually gave him a book that I bought as I qualified. I qualified and it was like, it's like how to prevent back pain as a dentist. It was something along the lines of that, right? And I bought it even though I never had back issues. And I bought it and knowing that one day I might need this. And I gave it to him and he found it incredibly helpful. And he'll be attending the program that we're doing together. And he's really looking forward to it because he had an MRI, he had this, and he really suffered. You know, the business suffered, he suffered. It was terrible. Well, we see this all the time on the dental forums. Here's the thing though. Is it linked to posture? Is it linked to what we do? And when we spoke the other day, I was in severe issues with my shoulder because in the gym, I only know this now. In the gym, I was doing something called upright rows, where you grab a barbell and you bring it up, okay? And I didn't know you're supposed to bring it up to your lower ribs. I was bringing it all the way up to my chin and holding it there. And I only know now, thanks to Gemini and ChatGPT and all those good things, that whoa, that is really bad. That's doing things to your shoulders that you should just not be doing. And no wonder I was in agony. Right? And so we are doing the dental equivalent of putting our body and spine into different positions. However, the point I'm trying to make is there is a school, for example, in occlusion, the world of occlusion, there is a very prominent school of thought that occlusion has nothing to do with TMD. And I reject that thesis. There is also, in your world, a prominent field that says posture has nothing to do with back pain. And of course, obviously, you reject that. Can you tell us more about your experience of that and how your perspective on that?
Well, I like to use metaphors. And, you know, when you get your license to drive a car, you learn how to drive the car and you learn the road rules. Otherwise, you would be dangerous to yourself and others. In a way, when we graduate from dentistry, we're given the keys to the car without teaching how to drive the car. And so we drive ourselves in wrong gear and we don't know the road rules. And none of it is rocket science. We don't learn what to do and not to do with our neck and back. as we look into the patient's mouth, and we don't learn what to do and not to do with the shoulders and arms and our legs as we step on the foot control. And if we learn that, there wouldn't be the alarming incidence of occupational chronic pain that I'm seeing everywhere, and studies have shown that. It's a matter of learning what to do and not to do, and that's what I teach. And that is based on biomechanical design principles, looking at joints as to what they're designed for. For example, the spine is not designed for bending. If you're in movement, for example, dancing, moving around, you can twist and bend any which way because you keep coming back to neutral. This in between each vertebra will, although they get squashed and squeezed and distorted as you twist and bend, you keep coming back to neutral and the discs come back to their shape. But in dentistry, when we hold the posture and we don't come back to neutral, well, we're doing damage. And so things like that, or learning that you can't just have your shoulder and elbow raised because you're using movement muscles. These are fast twitch, predominantly fast twitch muscles, which are designed for a quick movement and then stop. But holding at least 4 kilo, an average arm weighs at least 4 kilos, and we hold that up against gravity for lengthy periods, well, of course we're going to be in pain. So these are really simple things. And it surprises me sometimes when I think about it, how simple these things are and so obvious. And it's exactly what you said earlier. Dentists are shocked. How did they not know this? Well, it's outside their awareness. You don't think about it until you do. And then you think, but of course.
I'm so excited to get deep into this. And just one last point on occlusion then is the whole belief that occlusion has nothing to do with TMD, but it's the whole thing that there's the occlusion, but then there's the occluding. And someone who's spending their teeth together for clenching and then pumping those muscles and even their sort of oral posture and the tongue involvement, of course, that has a background biomechanical effect on the TMJ. And so that's why I truly believe what you're saying. And I think there's a reason why in dentistry we have this huge issue of back problems. It can't just be that we're more stressed or we drink more caffeine or whatever. There is an obvious postural cause. And so let's begin with that, right? I want you to give us 5 mistakes that we're making or 5 things that we could change in our practice tomorrow, because this podcast is all about quick wins. It's about making things practical and tangible and applicable on Monday morning. Okay, so usually podcasts go out on Tuesday. So on Wednesday morning, what can people do? Start with what you think is the most profound. Like, for example, one thing you told me is why lifting your elbow is destroying your back. And I'm like, how do I not lift my elbow? So it could be that or anything you want. What's the most precious one, Aniko?
Well, we might as well start there. So if I said to you, hold your arm out, and I'll sort of hold my arm out as much as you can see it for podcast listeners. If you raised your arm at shoulder level, and I said, or even halfway, doesn't matter how high, and I said, do that for several hours, you would get a sore shoulder. And of course, you would have a sore upper back, because the trapezius muscle is a trapeze diamond shape, and you're going to feel it along your upper back. So what happens is that when the shoulder and elbow is raised, then it's usually the non-dominant side, because the dominant side, let's say if you're a right-handed dentist, you're moving. It's not so common to have a problem on the dominant side. However, some dentists do a kind of a rotation and a twist of their arm. But what's most common is that on the non-dominant side, where you're holding the mouth mirror, there is a lift of the shoulder and the elbow. And that means that muscles that move the shoulder and elbow and arm, the arm really, they are movement muscles and they're contracting for long periods, which they're not designed to do. So you're guaranteed to have a sore shoulder and upper back.
So am I right in thinking that because I prep with my right hand, I'm right-handed, but I'm holding the mirror in my left hand, so I'm moving around my right hand, I'm picking things up, I'm returning to neutral, whereas my left is my mirror, and therefore it's staying in that position, and that is part of the root cause of why we have a lot of issues.
Very much so. So the solution to this problem, and this is very common, I'd say 70 to 90% of dentists and also hygienists, oral health therapists have this problem. as well as dental nurses. For them, it's a slightly different method, which we'll address on the Saturday when we're running the workshop. First of all, to just let gravity have its way with the elbow. So not holding the elbow in, not lifting it, just doing nothing. The arm is not going to fall off, it's attached. Sometimes I've seen people, some dentists have been told, hold your elbow against your side. Well, then you're using a different set of movement muscles to do that. So do nothing with your shoulder, do nothing with your arm. But the really big part is your fingers in the mouth. As you hold the mouth mirror, park your finger on a tooth or the angle of the mandible so that you're not holding the arm up in the air. Hovering with the mirror is the same as raising your arm to whatever degree.
This is so simple, but so wonderful. I mean, I'm just literally, the reason my eyes are rolling there is that I was recalling, right? And I'm thinking, I'm imagining myself doing my dentistry. I've got so many hours of videos because I record my procedures. And I'm after this call today, I'm going to look back at my videos and say, what am I doing with my mirror? Because I like using a finger rest for my right hand when I'm prepping and stuff, but I'm not sure if I'm using a finger rest for my left hand, actually. And that's such a key thing. And I'm definitely sure my elbow's out. And what you said about just making it limp and letting the elbow just fall is so simple and beautiful and not activating anything, that we just love to do nothing. You're saying do nothing, man. I'm there. I'm ready to do nothing with my left elbow.
Absolutely. However, adding that part of parking your finger on a tooth, because parking your finger, having a finger rest or a anchorage for your operating hand, that is for the patient's safety. Otherwise, you could slip with your instrument or rotary drill. Parking your non-dominant hand, so for you it's the left hand, on a tooth is for the safety and wellness of your body, for your shoulder. Because even if you let gravity have its way with your elbow, you're still having to brace your arm in order to hold up the 4+ kilo arm against gravity. So park the finger and let the weight of the arm be taken by that spot, whether it's the angle of the mandible or the tooth. It's not going to hurt the patient. Thousands of dentists I've trained, not one has been taught to do this. One hygienist among all the people I trained. So it's very uncommon.
No, I was always taught for my right hand a finger rest, and actually it wasn't even for patient safety. It was like, so your preps can be better, so you have more control in your handpiece. It was actually about me and the prep still, and not about the patient safety. But I haven't been taught to have a finger rest for my non-dominant hand. It just makes so much sense. And one thing I do like to do with my patients is I say, hey, look, while I'm treating you, I'll be resting on certain teeth, just to let you know that is for stability. And so then they're, okay, fine. Otherwise, they think, why is there, sometimes patients are thinking, if we put ourselves in their position, why are they resting here? Why are they resting there? Just a quick sentence, and then it kind of primes you as well. It's like a routine, a habit. If you habit of saying this, and therefore you will do it, is a really cool thing that I like to do. But now I will totally start doing it with my non-dominant hand. That is brilliant.
It is.
What else have you got for us? Sorry.
Let me just add one
Please.
Point to this. Everything we do is a habit. It's like software in the brain. So if you've had the habit, and literally every dentist has had the habit of no finger rest on the non-dominant hand holding the mirror, then even when your listeners are remembering when they first begin to treat a patient, they say, oh yes, Aniko said I should have a finger rest. And then what happens is, because the programming in the brain, the neuromuscular firing pattern, has been trained to not have a finger rest, in no time the hand comes up. So it's a really good idea to ask the dental nurse, the dental assistant, to remind the dentist each time the hand comes up, just a wave, and that is a way to break the habit of not having a finger rest.
That is just perfect. I'm actually, as I'm talking to you, I'm actually looking at my video. You can't see this, but I'm actually looking at my rubber dam videos now, and I'm holding my left mirror, and there is no finger rest. Like, I've got rubber dam on, and my mirror is just hovering there, and I'm like gobsmacked. And you made an instant difference to my life. If we just stop this podcast here, we have enough to make an instant improvement, but we're not going to stop there, because we got a few more. So Aniko, so that's a huge one, and it just makes so much sense to me. Thanks for breaking it down in a way that makes sense, and thanks for allowing me to just quickly see, yes, and shame myself. And there we are. I have something to do. I'm seeing this as a positive step to create a new habit, and I'm really excited for that. What else is a cardinal sin that a lot of therapists, dentists are doing day in, day out that is toxic for their posture and back?
Yes. So a big one is coming off the vertical. So most dentists and hygienists and therapists will lean towards their dominant side, and in order to look into the mouth. So they'll sit in whatever o'clock position, and many of them are in their thinking are literally cemented into one position. And then they bend usually to their dominant side, and then they might lean the other way. And so coming back to the spine, it is really important to know that below the height of the ear, every single intervertebral joint is a plane joint or a gliding joint designed for just tiny glide. Now we can twist and bend. And as we spoke earlier, if you're in movement, dancing, whatever, and keep coming back to neutral, that's okay. However, if we're leaning forward or to the side, either which way, we are squashing, squeezing, and distorting these discs, and we are doing that for lengthy periods. And there is no easy recovery. And what we're doing is called cumulative trauma. At first, we don't feel it. Trauma accumulates moment by moment. When we do something that the body was not designed to do, trauma happens. If we had a 20-minute break between each patient and we could lie down and rest, we would be recovering, but no dental practice runs that way. So the trauma accumulates and continues all day. And we don't feel this for a while. And by the time there are any symptoms of discomfort, pain, tingling, stiffness, it's been accumulating for a while. So I talk about cumulative trauma. It's another word for musculoskeletal disorders, which doesn't tell you what's happening. Cumulative trauma, it tells you you're doing something your body wasn't designed to do. Wrong gear.
I think
so. Go on.
I think of micro trauma when it comes to TMD. Like micro trauma is a word we use.
Yes.
Macro trauma is like a road traffic accident. Micro trauma is that daily clenching that's putting more pressure
Yes.
into the joint and the disc structure and the ligaments.
This is micro trauma at a cellular level for as long as we do what we're not designed to do.
And so the tangible pearl here in terms of vertical, how can we correct that?
Great. So what I say in all my trainings is this: move your stool into a different o'clock position. Move your patient, ask your patient to turn left, right, chin up, chin down, do anything but twist your spine.
So left and right is like you want to be completely vertical. So those of you watching, but those of you listening, literally my bum is static and I'm just leaning a little bit to the right and leaning a bit to the left, which you might do I'm imagining doing it now in the clinic. You do a lot. Actually, I'm doing it now, and actually to try and see that distal of the upper left molar, we do a lot. Actually, I'm actually really 40 degrees here or something. So what you're saying is try to keep as straight as possible, and then move the patient and move your chair. Have I got that correct?
That's right, because the spine wasn't designed for that. If you only did it once, that would be okay. But it's done it's done multiple times per appointment and also for lengthy periods, and the spine wasn't designed for that. So that's one aspect. Now, it doesn't mean that you hold yourself rigid, but you don't lean even a little bit. Even a little bit is doing damage. It's against the design of the spine. So that's something really important. And also something we never think of, and I certainly didn't, is that gravity is acting on you all day long, all the time, and it's always in the vertical. So there's uneven pressure on various joints as well as disc damage. Muscles on one side are slack, on the other side they are too tight. It's mainly it's the spinal damage. And adding to that is the fact that most dentists believe that they can sit upright and bend their neck around 67 and look into a patient's mouth, whether they use non-refractive loupes, so this is the traditional loupes like prismatic or Galilean, or no loupes. And most of those dentists have either had already surgery for C6, C7 damage or have been told that they are likely to have it, and that's the reason. And we don't learn in dental school that you can't sit upright and hope to look into a patient's mouth unless you are using an operating microscope or refractive loupes. Then you can sit upright and look into a patient's mouth and you look straight ahead. So that's
what you're saying
another
is that
one.
Angle of declination is a real bad thing, how we're holding our neck down. Look, when I transitioned from regular loupes, let's call them, to refractives, I didn't really realize the huge benefit. I was like, oh, this is cool. I'm now looking forward. But I didn't notice a big difference in my neck until the day I switched back to my regular ones, and then I had to put my neck down. Then I was like, whoa, now I feel it. That was a really crazy experience because, going to the better position was like, okay, this feels no different. But then when I went back to that bad habit of regular loupes, so, for me personally, N = 1, okay, refractives do make a lot of sense, but hearing it from you, the expert, Refractives and operating microscope is the way to go, especially now when there's so many options available. Really, if someone's looking to purchase some magnification, they should probably bypass the regular loupes and go straight for refractives. Is that a fair advice from you? Hello, YouTube Protrusive. I know you're watching on YouTube, and I hope you're enjoying this episode so far. But I wanted to highlight, in case you don't know yet, we have an amazing viewing experience on protrusive.app, our website, our network, our platform. So I just want to spend a minute to show you what this looks like. On the left side, you see the navigation, and when you join the app, you get a 1-minute video tour of the entire network. Now, in terms of where the magic happens, that's in the Protrusive community, because you might come for the content, but you'll stay for the community of the nicest and geekiest dentists in the world. We have all these polls, we have a chat group, there's always active chats and dentists helping dentists. And really what I want to do is create a really supportive environment that's not like the environment we have on Facebook, and is built on the values of niceness and geekiness. If you are nice and geeky, you belong here. Now, to make this a safe space, we have a manual process of approval. We actually verify that you are a dental professional before you get in here. So we have hundreds of applicants a day. So if it's been about 2 days and you haven't heard anything, either something's in your junk or you need to reach out. If you're still waiting to join your tribe, email marie@protrusive.co.uk. That's MARI@protrusive.co.uk, and she'll investigate what's happened. Now, all the videos you have on YouTube are also on here, but you actually have some extra ones for free that you don't have on YouTube. So you get some bonus content that's not on YouTube. And actually for the future, I'm not taking things out of YouTube, but some things are not appropriate for the wider public, and I want to sort of safeguard that information, which is like dentist talk, if you like. So that's why a lot of the content is only here and not on YouTube. So you're kind of missing out if you're not on here. That's why I'd love for you to join there. And if you join one of our paid plans, then what you get is access to the CE quiz, like this one, and you can get CPD or CE certificates, and also you get our premium notes. So these are a great aid memoir or revision for an episode to really cement your learning. And whilst we have ads and YouTube places ads on YouTube, we don't have that on our network. So for the paid plan, you get to see all of the premium notes without any of the ads. And of course, you get to support Team Protrusive and help us to continue what we're doing. I'm just going to gloss over the Protrusive Vault, which has all our infographics and downloadables. These are all our masterclasses at this moment in time, and we're always planning to add more. And if you look at them, there's about 1, 2, 3, it's about 7 of them. But actually, if you look at the replay section, some of the live masterclasses that I've done and some of the training that people pay for on other websites is all on there, included as part of the masterclass subscription. And if you're a student, don't fear, we have a special section for you with all the student notes, which anyone can access. So for example, here is one on exodontia. So it's all there waiting for you on Protrusive Guidance. Please head over to the website, which is protrusive.app. Make an account on your browser. This could be Safari, Chrome, however you want to do it. And once you've made your login, then you can download the iOS or Android app and then log in through there. So the reason to make the subscription primarily on the website first is that you get access to a free trial, which you don't get if you make an account on Android, iOS. If you make it on the website, you get access to the free trial, and you get our best price if you sign up through protrusive.app. So our best deals and free trials are only on protrusive.app. Of course, we always put the link below in the description, and thank you so much for enjoying our videos on YouTube. But it's now finally time to level up your experience. Back to the episode.
Absolutely. And I just want to pick up one thing, that bending forward that you had to do when you were using your other loupes is an absolute red light, red flag. The spine wasn't designed to do that. Now, the problem with non-refractive loupes, the traditional loupes, is that, first of all, dentists don't know that if they are using those, then they can't bend, they shouldn't be bending their spine. They need to pivot their whole torso forward at the hip joint, just a little bit. And the angle of declination of the loupes has to be right, about 45 degrees, and most are not. They are lacking that much declination, so dentists have to bend their spine even when they come forward at the hip joint. So I now recommend to go straight to the refractives and to be sure that you're measured up correctly, because some dentists who are used to bending forward will be somewhat forward bent when they're measured up for their refractive loupes, and they need to learn to sit well.
I totally agree. And one thing is going back to your patient and how we should coach them to move around so that it spares us. And sometimes we think that we want this appointment to be comfortable for the patient, and where we might feel shy and we might say, oh, it's okay, I'll bend a bit to save it. No, that's wrong, because we're doing it every single day, day in, day out. They're just there for half an hour, 2 hours, whatever it is, and they're totally fine with it. And one technique a prosthodontist, Mahul Patel, taught me was that I say to my patients, well, today is going to be like yoga and Pilates. We're going to be moving around a lot. This is so that I can get the best access and give you the best quality care possible. No one's ever said no. Everyone's like, oh yeah, I definitely want you to see what you're doing. And even if you joke, that's so that I can see what I'm doing. And everyone, they laugh a bit, like, okay, yeah, I better do what he's saying, because I want him to be able to see what he's doing to my tooth, right? And so patients play fine with this. And so to get the permission from a patient when you use terminology like that, and everyone gets it, yoga, Pilates, moving around, and patients are totally fine with it, in my experience.
Absolutely. So I've done a lot of training, and I teach communication, and everything lives in communication. And often then they say, oh, I can't possibly ask my patient to turn. And I say, well, do you want to have career longevity or not? And then you say to me, Mrs. Smith, Mrs. Smith, it's an absolute pleasure to treat you, and I'd like to do that for a long time. I've just learned, I've done some training in dental work postures, and I want to look after my back because I'd like to look after it for a long time. So I'm going to ask you to turn just a little bit for a little while, and you thank them before they even start moving. Oh, thank you so much. That's great help. Now this is better for my back and I can see better. So it's just letting them know. And they are fine, especially if you let them know that your comfort is really important.
Yeah. So for me, I and that's amazing. I don't make it so much about my comfort. I say so that we can give good quality care. And whichever way you go, some patients might feel, and some dentists might feel like they want to pick a lane, but to say both is wonderful. But just whichever way you do it, have that communication and make it known to the patient that, okay, there will be some movement. And then again, it's another habit, right? So first you told the patient, I'll be using a finger rest. Then you tell the patient we're going to be moving around. And then the more you do this, the more you are, because it's all about trying to get rid of our bad habits. And those bad habits are so deeply ingrained that we need to really actively use every skill that we have. And this is like the communication skills element of it. It's not only just for the patient, it's to persuade your brain to adopt this new way to undo the years of the wrong way you were doing it. And so that's why I believe in it as well. So it sets the tone for the appointment.
Oh, very much. And I'd like to just say something along that line. I like to teach kindness, and I don't call anything wrong. I just say it's harmful. And it's not your fault. So it's not the dentist's fault. We never learned. We do the best we can based on what we know, and we just want to get the work done and look after our patients. Once you know that certain movement and posture patterns are harmful rather than wrong, then you can say, well, how can I do this better, more optimally? But to be kind to yourself, because it's not your fault. I didn't know. Most people don't know. And now you do. And how wonderful it would be if we learned in dental school.
Yeah, I think let's be compassionate as well. So I've got a really cool episode coming on compassion-focused dentistry as well, which is just all about this kind of stuff. Is, you know, what's happened. The best time to learn all this stuff was at dental school, and so that you hit the ground running. The second best time is today, right? And so you take these habits. The worst thing someone could do, right, is listen to this episode and then go back to what they were doing, forgetting the finger rest with their non-dominant hand, keep bending their neck in all sorts of positions and not train themselves to do that. That's the worst thing a dentist can do, is listen and not apply. To know and not to do is not to know. You might as well not know it in the first place. It's the application that matters.
However, we come up against what I already mentioned is habit change. And I spend a lot of time teaching how to change habits, because whatever you have done many, many times feels comfy and normal and natural because it's familiar. And that habit lives in your brain as programming software. And so even when you say to yourself, I'm just not going to lean to the right, for example, in no time you'll be doing it and you won't even know you're doing it, even if you are very committed to look after yourself. And that's why it's important to get support. So when I go out to train practices, I train the dental assistant to wave to the dentist and let them know. And of course, it's a signal that they need to agree on. And the dentist needs to give permission for coaching or support. Otherwise, it seems like the assistant is nagging. And then the dental assistant can keep reminding the dentist when the dentist bends forward or to the side or not having a finger rest. And then over time, when it comes to changing software, you can delete in 2 seconds anything you don't want. When it comes to changing the neuromuscular firing pattern, the software in the brain for habits, You need to keep on breaking the habit over and over and over for at least 6 weeks. And it's much easier when you have help.
And this has been shown, like, for example, can you teach emotional intelligence, which is deeply embedded in the neural channels of your brain? There's neuroplasticity. The more you work out that nerve channel, the bigger and stronger it gets. And so all our bad habits, the good habit part of it, are actually very, very small, tiny traces in our brain. So anytime we are working out anything, a muscle, a habit, or anything, it should feel like this is difficult. It's not going to be easy. It feels like a workout. And so therefore, we have to go out of our comfort zone to then actually have a new comfort zone in the future. And I mean that obviously, but posture-wise, but also just the sanity-wise as well. So it's not going to be easy. I don't think any workout that you do that's changing how you use your muscles, it's going to be hard work. So don't think, oh yeah, I'll just quickly do this, because you'll notice yourself changing. So this is something that needs to be practiced. Just like the years of the bad habit, it'll take a bit of time to practice.
Absolutely. And doing something in a more optimal way, more optimal work postures against harmful habitual work postures will feel weird. The old one that was causing damage, micro trauma, cumulative trauma, feels comfy. Not doing it that way feels really weird and different. And of course, we need to keep reminding ourselves that we are important. My motto is take care of yourself. You are your most precious instrument. You only have one precious spine. You are important. It's not just your productivity. You are important. And somehow we get to believe that we're not important or we don't care. I know that I used to practice as if I was a disembodied pair of eyes, brain and hands, and the rest in between was like a black box, a vacuum. I never thought about it until I realized that this is why I've been in pain for decades.
One of my old principals, Amit Mohindra, he taught me that we spend so much money on these milling machines and this and the chair, but how much money do we actually put into things like our fitness, our health, our posture, all these things? So it's definitely like the foundations. It's like your health is so important that it's actually technically more important than your family and your kids. And the way that is that because if your health is not there, you are not there to serve and help your family. It's a bit like in an airplane when something happens, they say, do your air mask first, then do someone else's. So the best thing you could do for your family, for your longevity, for your business is actually look after your health. And where better to start than the place that we are weakest is our posture. That is our big weakness because of the nature of what we do. Now, so far, we've talked about not raising your elbow, using the finger rest, which is really, really powerful. Then keeping our back straight, allowing the patient to move around, allowing your chair to swivel around. We also talked about the importance of refractive loupes and that angle of declination. And actually the straightforward advice that actually if you're getting your first pair of loupes, just make them refractive or an operating microscope. And if you are suffering and you're using regular loupes, maybe now is a good time to invest in some refractives or an operating microscope. And what else have you got for us?
Another really good one is calibrating the dental stool height. If you're sitting too low, you are jamming your femur into the hip joint. The old ergonomic guideline was that your thighs should be parallel to the floor. If they are, then you're jamming your femur into the hip joint. The ideal way to sit is to have the hip joints a little bit higher than your knees. The reason is that then you can release the weight of the legs. Each leg weighs at least 12 kilos, and you want to give the weight of those legs to the floor. Now, something that I see a lot is that dentists who are sitting on saddle stools are sitting too high. And what that means is that, and you won't feel it. Do you sit on saddle stool?
Honestly, like, and this is a bad thing about me is when I go into work and then the nurses come and they go, they're doing this thing that's like musical chairs. They're literally swapping chairs, right? And I just get the one which no one wants, and I'm totally fine with it. I'll sit on anything, right? I come from very humble beginnings. Okay. I'm like, don't worry about it. I'll sit on anything. But you know what? Here's a really really bad thing, and I'm going to change it straight away. And you've already taught me this: is whatever the height is of the chair from the previous dentist who's worked there, I don't even look at it. I just sit down. Okay, I'm ready to do my dentistry. I don't need to mess things about. But I know that I'm one day it'll be higher, one day it'll be lower, and I'm not even thinking about it. And that's really bad. So yeah, what is the way it should be?
Okay, so I want to tell you, when you're sitting too high, and I see a lot of dentists who are sitting on saddle stools sitting too high, they, even though the sole of the shoes are on the floor, their heels are not fully released into the shoe. So their weight is actually on their toes. What that means is that when the legs are not fully given to the floor, lower back movement muscles, so there are superficial muscle layers, there are deep postural muscles, which are designed to fire for a long time, they're slow twitch. But then there are superficial movement muscles, and those muscles of the lower back have to start contracting to manage the weight of the leg if you're not giving the weight of the leg over to the floor. So what I say to dentists is calibrate your stool in such a way that your hip joints are higher than your knees, but not so high that your heel is not fully released. So you go up and down a little bit until you feel that your heels are fully released into the shoe onto the floor. And that's an important one.
So you want full contact from heel to toe. You want that full contact of your feet on the floor.
Yes, on the floor. It also means that when you're sitting, whether you're doing dentistry or just sitting anywhere, you want to have your feet on the floor. You need to have your ankles underneath your knees. If you're crossing your legs, if you're having your legs underneath the chair, twisted around the leg of the chair, I used to do all those things. You're not giving the weight of your legs to the floor, and that in itself will cause lower back pain.
Okay, so like don't bring your knees, like don't bring your don't bend your knees in so that your like your heels are like behind you. They should be very much planted at the same level as your knees, basically.
That's right, because weight is transferred from your knees down to your ankles.
So some people might be resting not on the floor, but they might be resting on the, you know, the legs of the chair, like as they swivel out. They might be resting like I'm doing it now, kind of thing. So is that's bad as well?
Well, let's call it harmful rather than bad. It's harmful.
Yes, of course.
Because you're not giving the weight of your legs to the floor. You're asking movement muscles of your lower back to manage that weight. So habits like that are really important to break. And what I always recommend is that you start noticing your postural habits away from dentistry when you don't have a patient and you don't have the clock ticking, because unless you can start becoming aware of how you do what you do and then change it to something more optimal that's not going to cause micro trauma to your body, then it's easier to make it a habit in the clinic when you have a lot of other considerations, including the patient. And
I think every single person who is listening to this in their car, or me just now, or even when I Zoomed you last week, like when I see you, I was like, oh, okay, let me fix my posture up. I'm trying to impress Aniko. Let me make sure my posture is good. And that's fine, because you need to be aware, just like you said, outside the clinic as well. Common sense.
Absolutely. And while we're talking about that, a really big one I'd like to recommend to all the listeners and those who are watching is that unless you can become aware of what you do with your mobile phone when you're not doing dentistry, and break any harmful habits, then it's a too big an ask to become aware of what you do in the clinic. So if you are in the habit of taking your head down to the mobile phone, you're damaging your spine. You have a wonderful hinge joint called the elbow. You bring the phone to you, up to the face, or have it on a stand. I've got lots of stands. For example, you can get a variety of stands like that, where you're not even tempted to look down. And the amount of neck surgery that American neurosurgeons are reporting among young children and teenagers is ridiculously high. They said there's been an exponential rise since mobile phones became popular, because everyone is taking their head down to the mobile phone.
Well, I'm just trying to correct this now, because I'm listening to you, and I think about this a lot, actually, and I try and practice this. But if I'm bringing my phone, if I'm bringing my elbow up, but then I'm actually now lifting my shoulders up as well, and I'm trying to bring it eye level. I sometimes do this, but then is that bad for the fact that I've now brought my shoulder up? No, sorry, harmful. Is that now harmful for that?
Absolutely. For you, well, this is something that I will be teaching, and I might as well mention it, is that when you lift, actually, that's a really good one to mention while we're at it. What we do as dentists is that every time we move our hand, we move our shoulder at the same time. So we pick up things it's almost like the hand movement and the shoulder movement are married. You want to divorce from that. The finger leads the movement. You can, if you now don't move your shoulder, just start movement with your fingers and see how much movement you can achieve, how high you can raise your hand before you do anything to your shoulder. There's a lot more to this, and I spend a lot of time teaching this. So you don't have to raise your shoulder. And of course, it's great to have these mobile phone stands so that you don't have to hold it.
But one cool thing I've been doing, Aniko, because there's this cool thing that I'm doing at the moment, is I've got my loupes and my refractive loupes and a camera attached to it, right? And so the procedure's playing on the laptop live. But what I'm then doing is the patient's got these glasses that they're wearing, and as I'm doing the patient's examination and checkup, they are seeing real time my examination. So they're, oh, okay, I'm going to check your gums now, I'm checking your teeth now, and they're like this immersive experience, and they are blown away. I'm going to talk more about this over this next year. This is like when you get your car serviced, right? And they're sending you a video of under the hood of your car, and they send you a tire and stuff. This is the future of dentistry, in my opinion, the communication. Anyway, the reason I mention that is because I then started to use this device, these glasses, plugged into my phone, because that's why you watch your Netflix, everything. So the reason. One of the benefits of these glasses is that instead of looking down your phone, you actually wear these glasses like using an operator. You are seeing the screen of your phone through the glasses, and you've got a lovely posture. And you're on your phone, but you're looking straight ahead because you're looking into the glasses. So that's
fantastic.
A cool thing as well.
That is great. It's excellent.
Good. So that's not harmful. That's good to know. But I've learned so much here. So let's just summarize, and then let's talk about how we're bringing you to the UK to do a very, very special full day to teach dentists, nurses, therapists, the whole lot, because we desperately need it. Because this is a nice intro, but I want you to get into specifics, and you can only do that because the way you do it is you lecture a bit, and then we'll have a chair there, and you'll demo on the chair, and we'll have a cameraman there. And so we'll talk more about that in a moment. But to summarize, it's testing my memory now. Number one was don't raise your elbow, right? And have the finger rest, not only just for your dominant hand, but for your non-dominant hand. Number two was to keep your back straight, but to get the communication skills to make sure that the patient is happy to move around, and you're going to move your chair around as well. Number three was the use of refractive loupes. Number four was be aware of your leg posture. What are your legs doing? Is the height of your chair correct? Number five was about how to use your mobile phone, and just generally being aware of everything outside of the workplace, but starting with phones, because this is a huge, like, if you're going to get the greatest return from one tip, is every time you're on the phone, be aware of your posture, use a stand, use some glasses, use whatever you want. But I think if a lot of dentists would just fix that one issue, it may actually improve. Like, it might take them below the threshold of pain and problems. Because again, that's another micro trauma thing that's happening, right?
Absolutely. And they come into dental school. Before they even do dentistry, they've already had that habit of taking their head down to the mobile phone. Then they continue to do that. And also it's a training for what I call postural awareness. We tend to be on automatic pilot, and we just want to do whatever we want to do. We don't think about, how am I doing what I'm doing? What am I doing to my body? How am I sitting? What am I doing with my legs, with my arm, with my spine? And unless people train themselves to be mindful and become aware of their posture, and the mobile phone is such a good example. And again, it's really important to ask for support. And I recommend that dentists who want to change this habit, and I highly recommend that they break such harmful habits, they ask the people they live with and the people they work with and say, anytime you see my head going down to the mobile phone, please come up to me and bring the phone up. And when I run my workshops, I tell dentists first thing in the morning, very first morning, before tea break, and I ask permission to keep coming up to them and raise the phone. And guess what I do all day over 2 days is keep raising the phone, because it's not that they forget. The habit does you. You're not doing it. The habit drives your behavior. So every time you notice and you break the habit, you make that habit weaker. And they always go, sorry, Aniko. And I say, don't say sorry. This is the habit doing you. So
but it's that nuance of raising your elbow, bring it higher without then bringing your shoulder into it as well.
Yes.
But again, look, I don't see an issue with, if you're in the clinic, if you're literally in the clinic and you need to use your phone because you need to check your emails or whatever for labs, use your refractive loupes.
You can.
Why not?
Absolutely. However, this is part of the training to not do that.
Yeah.
Yes.
Yeah. Excellent. Well, let's talk about Saturday, 13th of June. We're going to get you flying from, whereabouts in Australia are you?
I'm in Melbourne.
Beautiful Melbourne. Okay, you're in wonderful Melbourne, and you're going to fly to us in London Heathrow, and you're going to put on a day for us. We're going to do something privately in our surgery to really immortalize your teachings. But on the Saturday, 13th of June, in London Heathrow Hotel, TBC, we're going to have a full day of you. My vision is to invite dentists, endodontists, periodontists, therapists, hygienists, and for those who go in the early bird rate, they'll be able to bring their nurse for free, because I think there'll be such an electric atmosphere. And we spend so much time and money on composite veneer courses. I know dentists who will go on 6 of them in a year, right? At great expense for the same thing. But what we don't do enough of is communications, and what we definitely don't do hardly any ounce of is ergonomic training. And I think this is the one that's going to really, yes, the other stuff will make your restorations look pretty, make them last longer, but this will make you last longer, so you can actually do that pretty stuff for longer. So tell us about the typical day of how it works. Like, I'm particularly interested in about how you teach a large group and the role of a cameraman, the role of a mobile dental chair. Tell us about how you can actually make it a really mind-blowing experience.
I'm going to teach the basic principles so that the audience understands what is harmful and why, and how to do it different. And I will be teaching that. And as we go along, I'm going to keep on demonstrating and applying it to clinical and daily situations. I'm going to talk about what dentists do in their daily life, because unless they can become aware of what they do in their daily life and change any harmful habits, it's too difficult to do it in the clinic. But most of all, we'll be looking at what to do around the dental chair. I'm going to demonstrate and teach how to apply the principles that we'll be learning in the beginning into sitting and standing and doing dentistry, how to step on the foot control without doing damage to the hip joint, how to organize to have the foot control where it should be. Most people don't even think about it, just like they don't think about how high is the dental stool that someone else has sat on. We're going to look at how do you pick up your instrument so that you don't immediately activate the shoulder muscles, because there's a tendency to do that. So as soon as we go into the mouth, the shoulder is already up. And so I'm going to teach a different way of doing that. I'm going to teach how to sit and look into the mouth depending on what kind of loupes you're using. And also to have a finger rest, because there's a lot more to that. I'm going to teach how to organize the body to drive it in the right gear, how to activate the postural system rather than the movement muscles. Because when you pull up, for example, you were demonstrating just before pulling up like that. What I did for those who are listening, I pulled myself up to have the seemingly correct posture. That is a forced upright. I have just utilized my movement muscles to be upright, but that's not sustainable. And for that reason, people pull up and then they collapse. So I'm going to teach how to organize and activate the postural system in sitting and standing. And we're going to talk about how can you stand and bend over patients when you do extractions without damaging your spine, and how to utilize the big, powerful muscles of the hips and legs instead of the poor arm and shoulder to do extractions, because that's where the power base is. It's almost like you're driving a 8-cylinder car and driving on 1 cylinder when you're just using your arm. And a lot of dentists damage their arm and shoulder and wrist when they do extraction. So I'm going to teach some amazing ways to have career longevity and career and quality of life.
Who's the ideal dentist for when you teach around the world? And the ideal dentists, are they young dentists? Are they experienced dentists? Are they periodontists? Are they endodontists? Are they hygienists? Who's going to gain the most from this experience?
Everyone, absolutely everyone, because everyone basically does the same thing. Twist and bend, shoulder and elbow up. The foot is on the foot control in a way that the body wasn't designed to do. It's everyone. And also the dental assistants. They don't learn how to assist the dentist and look after the patient. They are twisting and bending the opposite way to the dentist.
I'm so excited to bring you over. We're also going to have a live stream option because we have the cameraman there. You'll be filmed, and those who are maybe in Europe, in the States, who want to join in. Timing wise, obviously depends, but when they join in live, they can see everything, experience everything from the comfort of their chair, and actually be able to apply this. We're also going to have good notes that we give to everyone who comes, and we're going to have some special offers from different Loupes companies. Obviously, we're talking very positively about Refractives. They'll want to demo their products, and a great opportunity for dentists to try different types of Loupes, which is so integral to their longevity and health of their back. Aniko, thanks so much. We've got the waiting list. In the outro, I'll give the link to the waiting list. But I'm so excited to meet you this summer. and to put on a great program together. Thanks so much for really giving us these wonderful, tangible tips that are going to change how we approach our back health straight away. But there's so much more to learn, and I'm so excited.
Well, I'm so excited to come to London and to make a difference to your community.
Amazing. Thank you so much. Well, there we have it. Thank you so much for listening to me and Dr. Aniko Ball. Isn't she absolutely wonderful? And now you know. Now you know there's something called the Alexander Technique, and you can apply it to dentistry. If you want to validate your learning, get a CPD certificate, this episode is eligible for CE, and we are a PACE-approved education provider. Just head over to the Protrusive Guidance app, scroll down under this episode, and answer the quiz. If you're not already on the app, you know what to do. Of course, if you want to take your learning to the next level, Saturday, 13th of June in London Heathrow, we're going to really build on the basics that we've covered today, and you'll be able to see in person exactly what to do, how to do extractions more safely, how to work with your dental assistant in a way that's going to protect both your backs, how to approach indirect vision into a mirror, how to work in the different areas of the mouth without straining your back or having to bend over. I think it's going to be a really lovely Protrusive. This is like our annual Protrusive event, and I'd love for you to join us, ideally in person, because there's a magic about in person. There's also going to be some Loupes on display on offer, but of course you can also join the live stream. To explore both options, head over to protrusive.dental/unbreakable. That's protrusive.dental/unbreakable. Thanks so much once again. I'll catch you same time, same place next week. Bye for now.